And this morning we are going to learn about international medicine. Or something like that. I'm really confused by all this. So to straighten us all out, Robin, we have Mary Strauss with us.
Our tour director. Hi, Mary.
Good morning, gentlemen. It's a pleasure to be here and educate you about international medical services.
Now, I've heard the term medical tourism before. Is
That's
this
correct.
the same thing?
Same thing.
Okay.
Medical tourism can sometimes refer to what we call domestic medical tourism, which is throughout the U.S., traveling to another location within the U.S., whereas international, we take patients from Canada. We've worked with patients from Germany before, so it kind of spreads out a bit more.
Okay, now, are these people that are on vacation that end up coming to the hospital, or is there a necessity other than that?
So in some cases with the Canadians, they travel here for their care. The folks that we had from Germany were here visiting for the summer with family, and then they needed, an orthopedic procedure or something. But the Canadians actually purposely travel here for care. Be it for specialty referrals or for surgeries, because they have a long wait list for surgeries.
Okay. So that's it. It's the wait list, and they want to...
Yes.
So I guess that means that they got to pay us.
They do. They actually pay us cash up front. They receive the same uninsured discount than anybody locally who doesn't have insurance. But they are paying for the services up front, which is great for the hospital. And they look at it as bettering their health so they can get on with their life. A lot of our procedures, orthopedic, hips and knees, that's kind of our bread and butter, hips, knees, spines. Okay. And people want to get on with their golf game. They want to get on with just life.
For sure.
Got our priorities now. All over the world, we hear about healthcare, about the superior healthcare coverage and insurability and everything, but this must be the downside, long waiting lists.
You're right. So the downside is the wait list. So just to give you a perspective, if you need a hip or a knee replacement, the current time, and I've watched it grow over the 15 years that the program's been in place. The current wait list is 12 to 18 months just to get in with the surgeon for the consultation.
That's in Canada.
In Canada, And it's fairly the same within British Columbia, Alberta, and Saskatchewan.
Okay.
In 12 to 18 months to get in with the surgeon, then you're looking at another 12 to 24 months to have the surgery.
Wow.
So there's quite the wait. And a lot of folks, if they have the financial means, don't want to do that. So we have a lot of farmers and ranchers, and they just tell us, well, instead of getting my new rig, I'm getting my new hip.
Okay.
What about the quality of care? Is that a concern for Canadians?
No, the quality of care, whether you're in Canada or in the U.S., is very comparable. There's no question with that. Okay. We've had several surgeons, from Alberta who have come down to the States and changed their practice to the U.S.
Let me ask you, you're talking about consultation wait time, and then the wait time for the surgery could be 3.5 years.
Correct.
Are there that many people that need new hips and new knees up in Canada that they're all in the pipeline like that?
There's currently, the last statistic I read early January was 80,000 people in the surgical queue. So it for hips and knees, I think they're sitting at about 30 to 40 within Alberta.
Yeah.
And then you get into the hernia repairs. They have a huge wait time right now for those because they're typically not considered emergent.
Yeah.
So
But they're painful.
They're very painful. Yeah. So we've got an influx of hernias. And a lot of times what happens, what I see and what I've seen over the years is a trend. So we say we'll take care of somebody who has a hernia. And then they go up and tell their friends, well, a lot of farmers and ranchers have them. So it becomes topic of conversation at the coffee shop.
Hernia palooza.
Exactly. The same thing with the hip. They'll see their buddy who's getting along really well. And then they go ahead and say, well, I had mine done in Kalispell.
Well, if they're farmers and ranchers, they want to be in good health because they're working their farms or ranches.
That's correct. Yeah.
And waiting 3.5 years probably would be really debilitating.
It is. So we can get them in within our normal surgical, what we would call wait list type of thing. So they just jump right in like a normal person from here. The only difference is myself and the other RN in the department, Jennifer, we kind of coordinate in everything that our local folks would have on our electronic medical record. We have to get those from Canada. So Jennifer and I kind of get that all together and then present it to the orthopedic clinic and say, here's all their records.
Okay.
Well, now, if we were going to have a procedure like
Yes.
that, we would start with our primary care physician and would work through the system.
Yes.
Clearly, they skip a couple of them.
They do. So we still work with their primary care physician.
Oh, the one in Canada.
The one in Canada.
Okay.
So we'll get records from them. And we've been taking care of patients so long from Canada that our name is kind of like, if a patient asks, well, what are my other options? What can I do? Then they can say, well, I've had another patient who's gone down to Kalispell. They can't put it out front because it goes against their College of Physicians and Surgeons. But if a patient asks, then they can move forward with it.
I'm trying to understand the wait time up there. Do they not have as many doctors, as many surgery bays, or what is it?
So it comes down to, because their cost is covered within their healthcare system, so say Medicare, they call it Medicare. What they do is they kind of limit the number of hips, knees, or whatever procedures can be done.
I see.
The surgeons also are limited on the time in the OR, whereas our surgeons may spend 2.5 days, maybe 3 days in the OR. Their surgeon may only get 1.
I see.
So they have to kind of triage their cases and take the worst of the worst.
But now, what about cardiac cases, open heart surgery, that sort of thing?
So those currently are cost prohibitive. Have we done them? Yes. But it's pretty expensive. And we do a lot of cardiac evaluations, some cardiac ablations, those type of items, pacemakers. But as a general rule, if you're looking like bypass surgery, they know we're an option, but cost-wise.
Yeah, it just doesn't make sense.
No.
Yeah.
What about emergency situations up there? Heart attacks, they obviously deal with them.
So the Canadian healthcare system is great at emergent care. So trauma, cancer care, things along those lines. And then the downside with our system and having my background in emergency medicine, their system, their patients aren't going to be bankrupt because they can't cover the cost, because it's automatically covered. So any type of care like that is covered through their provincial health system.
Mary, how did you come to this position?
Well, I was actually recruited by Valinda Stevens and Allison Mieleke and Karen Lee, the old nursing department head. And I was working in the emergency room and helping out Allison Mieleke, who did the foundation. And they came to me and said, hey, we've got a Canadian who needs some help. Would you be interested in helping us expand this business? And so, yeah, we went ahead and got that patient taken care of. And then it just went on from there. So as of April of 2010, I've been full-time with it.
Wow. Okay, so let's just say somebody contacts you from Canada and says, hey, I need a hip replacement. What's the procedure?
So we're kind of the one-stop shopping type of thing. So they'll connect with us with a phone call or an email, or a family member will contact us. And then we go ahead and send them an email and say, okay, here's what we need. And then Jennifer and I will collect the imaging, their notes from their family doctor, and we'll go ahead and work with them to get all of that together, tie it up with a bow and give it to the surgeon. The surgeon will look at it and say, yep, you need to have your hip replaced. And then we work with that surgeon's team to go ahead and get them scheduled for it.
How long of a process is that for us here at Logan?
So currently the wait list, just like the rest of our local folks, is about 4 to 6 weeks to get in. for a hip or a knee. If it's an emergent case, just like with anybody else, they'll go ahead and they'll see what they can do with scheduling to get them in sooner.
As far as a consultation prior to surgery, do they come down for a consultation separately, or?
No, we've streamlined the process over the years to where in most cases we can go ahead and get them in as one trip type of thing. So they'll come down, they'll have their consultation one day, any additional imaging that they need to have done, and then they'll have their surgery within 1 to 2 days after that. They'll hang out here for a day or two, and then Jennifer and I make sure all their records get back up to their family doctor in Canada, and they're done.
So they actually stay in a hotel while they're here?
Yes, if they don't have a place down here, we've had quite a few patients who have had houses in the valley.
Oh, okay.
So, but yeah, the majority of them will stay in a hotel. So it's good revenue for the hotels in the valley.
So they can you can do a hip replacement and send them back to Canada in 2-3 days?
About 5 days.
5 days.
So from start to finish, about 5 to 7 days. It just depends on how their surgery falls.
That's not much of an interruption in your life, is it?
No. And then they have a 2-week appointment with their family doctor to make sure everything's healing well. And then they'll do a phone follow-up with their surgeon here in Kalispell, just a phone follow-up at about 6 weeks, and then 10 to 12 weeks if needed.
Well, sounds like Canada's pretty okay with this.
Yeah, we follow their guidelines, with as far as follow-up post-op care. As long as they're an established patient of ours, we can do that follow-up care. But they're okay because it takes somebody out of the queue. So the next person can move up. So at this point, I haven't heard anything in about 15 years. So, and the lawyers look at it too.
Now,
so.
I've had total knee replacement, and I know they get you up within, 8 hours, 10 hours, and you're walking with a walker because they're weight bearing.
Yes.
And it seems like I went home within a day or two. Is it the same pattern for Canadians, or they can go to the hotel then? Or
It is. And they've shown over the years with research and whatnot that the sooner we can get you up and moving, the less likelihood of complications of blood clots and pneumonias and things along those lines. And they're doing a lot of these procedures as outpatient now.
Yeah.
My gosh. I had an air personality working for me at the network years ago, and she had to have some extensive dental work done. And she went to Mexico to have that work done. It was far less expensive, and she said it was top-notch care.
Yes.
So we're not the only ones doing this.
No. In fact, Idaho's doing it. Any of your border states are doing it. A big avenue, of course, is for those snowbirds. So Phoenix and Oklahoma City's pretty big on heart and orthopedic cases as well. Florida. So they have options.
So people are traveling around the country, too, to get procedures done.
They are. So even our local folks we're finding that are traveling.
A combination surgery vacation.
Exactly. Who wouldn't want to recover on the beach? You can't go in the water, though, until 2 weeks.
Oh, my gosh.
I was thinking you help expedite this international medical tourism, or whatever we want to call it. So you have people coming down from Canada. Do you get to meet them and see them when they're here?
Yes, often Jennifer and I will meet with the patient. Jennifer will go to them and meet with them at their consultation appointment, or we'll meet them at our office, and we'll just make sure they're all set for their trip. And we've noticed a lot recently that this is like their first surgery.
Yeah.
And traveling here for healthcare is really out of the norm for them. They're not used to, they're just used to being told where to go.
Yeah.
And this is the way it is. Here, we just like to make sure it's a pleasant experience for them.
So they come down, they're in the hospital and ready to go home. Now they have probably vehicle travel, or do some of them come down by air?
It's rare, but some of the ones from Edmonton will come down by air. We have a gentleman from Medicine Hat who comes down here for multiple specialties, and he has the wherewithal to just fly down. But the majority of our patients will drive down.
Okay, because I remember the knee replacement sitting on the back seat with my leg up,
Yes,
And
yes.
So I kind of wondered what that was like. Now, have you, after their surgery, have you seen them and seen the impact that it has on?
Oh, yeah. We've got patients who have been down for multiple procedures, or they'll come down and just visit the valley, and they bring us treats. Jennifer and I there's treats, there's home-baked goods, there's Costco.
That's right. We know that typically the Costco parking lot has been filled with Canadian license plates.
Yes.
Now, any experiences you have with this international medical services that really stand out?
Well, I remember a patient who had to have her hip surgery done, and I remember getting a letter from her afterwards that she was just happy to be able to dance with her husband again. Wow. We get notes from people who are up skiing now that haven't been able to, or people with spine surgery who can go back to work just because they have a herniated disc. So we get stories almost daily of how the impact that it's made on their lives.
Yeah.
Can you give us just a rough estimate of how many people you've worked with since you've been doing this program?
Oh, goodness. We've probably maybe 1,500, 2,000 people.
Wow.
Yeah, yeah.
That's a lot of people.
So quite a few people. And as I mentioned, there's some repeat offenders on there.
Yeah. And the ladies are happy because they can dance with their husband again, and the husband has dance lessons in his future.
The husbands can get into their tractor and just tune out the wife.
Oh, boy.
That's the way it works. This is really fascinating.
Yeah.
I had no idea. I knew there was a little trickle of that coming from Canada, but I had no idea it was this
1,500,
much.
2,000.
There's quite a few. There's quite a few on my list. I keep a running spreadsheet, and I've had to change it and move it.
This must be quite a revenue stream for the hospital.
It is. We do a fair amount every year. Mm-hmm. Yeah, we do a fair amount. It's a good boost for the hospital. Just to, especially in the light of the fact that we get it cash up front.
Yeah.
It's guaranteed. We know that income is there. Whereas when you're looking at insurance reimbursements and having to bill and rebill, there's none of that.
See, I've always heard that you submit the bill to the insurance company, and then they say, we need a little more information. It's just a cash flow thing.
Yes.
So it could be like 6-8 months before you get paid.
Easy.
Yeah.
Easy. Yeah.
So this is cash on the barrel hit.
Yeah,
it really is. Yeah. So it's helpful for the organization.
How does this work now with the merger with Billings Clinic?
So I suspect, it hasn't been approached yet, but I suspect that they'll probably want to venture out and do a bit of it themselves. Mm-hmm. They're not as close to the border as we are. They'd have to go through, the Dakotas and to get there. So how that will work, I'm not quite sure yet. I'm willing to dive in, though.
Are there perhaps some procedures they can do there that we can't do here?
Yes. Just because of the way the specialties are.
Right.
So
there could be some expansion there too.
There very much could be. Gosh. I've already expanded onto the High Line, so we're good.
Thanks for coming in, Mary.
Gosh, Mary, this has been great.
Oh, it's been a pleasure, gentlemen.